Thanks for staying with us on The Real Story. Last week, we broke down those daily COVID statistics given out by the state, what they mean and what you should pay attention to with Yale School of Public Health's Dr. Albert Ko. And there's so many questions out there that we didn't get to, so I decided to have him back again this week. We know it's been several months now that people have been vaccinated, so what are we seeing with breakthrough cases? What data is out there? We want to bring back Dr. Albert Ko. Thanks so much for joining us for part 2 of our conversation with you. I'm glad to have you on, too, because I want to start with the new news that happened last week. The CDC, a panel of the CDC making recommendations on who can get booster shots. This is only for Pfizer right now, people 65 and older, they say, long-term care facility residents, and people with underlying medical conditions. The CDC panel rejecting the FDA's recommendation to give a booster shot to people who are at high risk because of their jobs. So what's your takeaway on some of these recommendations? Can this make a difference for people?
Yeah, so thank you very much, Jen, for inviting me to come back for this part 2. So I think one of the things that you had mentioned is really key, that these are recommendations that only apply for the Pfizer vaccine. For those who received the Moderna vaccine or the Johnson & Johnson, those recommendations on boosters haven't come out. And as you mentioned, the FDA had authorized boosters for a wider group of people, not only those people who have high risk for developing the severe complications of COVID, but also those people who are frequently exposed to the COVID virus. The ACIP, the American Committee for Immunization Practice, which is an advisory group to the CDC, gave the recommendations for a somewhat narrower use of the boosters. So certainly those who are older, than 65 years of age, people who live in long-term care facilities. These were segments of the population that really had the highest burden of those severe complications of COVID. And they also broadened it in terms of, extending it to people 50 to 64 years of age with underlying medical conditions that also place them at risk of severe COVID. But it's the 18 and 49-year group with underlying medical conditions. And that sounds pretty broad and perhaps pretty vague. And that's where it's really important for, that recommendation was geared towards people to decide on their own what their individual benefits and risks are. And it's also fair to say that committee, the American Committee on Immunization Practice, were fairly divided on that note. There was a majority of a 9-6 vote that passed that recommendation. But they did come down not recommending boosters for occupations that place people at higher risk for infection. This could be this includes healthcare workers, but also extends to teachers and other first responders. So in the end, I think this makes sense from what we really understand about the vaccines at this point, and certainly the Pfizer vaccine. Pfizer vaccine still gives high effectiveness against the severe complications of COVID. There's some evidence now that it may be waning, but waning at small levels compared to like the Moderna vaccine. And this is perhaps a safeguard to really those people who we expect may have weaker immune systems or may have not only weaker immune systems and may mount reduced immunological responses, but also those people who have higher risk for the severe complications.
Sure. And in full disclosure, we are taping this segment on Thursday, even though it's airing right now Sunday morning. So we just got these recommendations. I know Dr. Ko was, going through them and looking at them. And you were just explaining to me that the panel recommended them, but the CDC needs to officially approve them. That may have happened already once this segment airs. So I'd highly suggest you check the news to see if that was recommended, because the key with this, Dr. Ko, is once the CDC officially recommends it, it's available here in Connecticut. I know Governor Lamont was saying that as soon as that CDC approval was happening, that we would have those booster shots available. And as we speak right now, there might already be booster shots being administered here in Connecticut.
Yes, that's right, Jen. And this is an advisory group, to the director of the CDC as well as the CDC in general on immunization practices. And it's usually the precedent is that the director usually accepts those the advice and recommendations that come from this advisory group. So, once that happens, once the CDC formally authorizes it, then boosters will be made available.
Yeah, we're not expecting the CDC director to necessarily do anything massively different from what this panel recommended, is what you were explaining. Okay, so let's talk about this next. Breakthrough cases. I know people who've had breakthrough cases, if we should be even calling that now. We know, obviously, with the vaccine that if you look at the efficacy, what was it with Pfizer, 92 or was it 96%? I don't remember. You have that other percentage there of people who can still get COVID. But it sounds like we're hearing more and more about people getting COVID who are vaccinated, which is a little bit alarming. So what is the data showing out there? It's been a couple months since people have been vaccinated. So we have, data to go off of at this point.
So we've been using the term breakthrough cases when somebody who's been vaccinated either gets infected, gets sick, or even develops the severe complications from COVID. And let me map out a couple of points important. One is that these vaccines, including the Pfizer vaccine, have high levels of effectiveness and protection against the severe complications. There is some evidence showing that the Pfizer vaccine may have lower amounts of effectiveness over time. That could either be because of the Delta variant, maybe more the immune responses produced by the Pfizer vaccine may not be as effective, or it could be because of what we call waning immunity, that the immune response is gradually waned. Though there are small decreases in the protection against those severe complications, but for that said, for the other vaccines, certainly the Moderna vaccine, those still are in general all high levels of protection against the severe complications of COVID, hospitalizations and deaths, and what we really worry about. I think the second part, what we're learning is that whether it's due to waning immunity or whether it's due to the Delta variant, we're seeing lower levels of protection against illness, getting sick, usually a mild or moderate illness to the COVID infection, than what we saw right after when we started, when the randomized controlled trials came out and when the immunizations programs started. And those levels of protection may be at as low as 70%. And so this vaccine is not 100%. And in general, people who have these breakthrough infections who've been vaccinated have mild or moderate illness. I think a testament of that is our experience here in Connecticut, but in New England, where we've seen cases of these breakthrough infections. We've had, due to Delta, but we've had very low numbers of deaths compared to other parts of the United States where large segments of the population are not vaccinated. And I think that really emphasizes the basic, the basic evidence that the people most at risk during this Delta surge are people who are unvaccinated.
Right. So you're saying the vaccine still, even if the efficacy lowers a little bit from when it was first out or the clinical trials were first out, it's still effective in preventing, not 100%, but preventing severe disease. So here's a question too. Do we even know if you have these mild symptoms, let's say, and you're vaccinated, you could think it's a cold. Like a lot of these people aren't necessarily going and getting tested because they're vaccinated. So are we even seeing the true numbers out there of people who, might be passing COVID or have COVID? Because the reality is if you're vaccinated and you have a stuffy nose and a sore throat, you might not be running and getting tested even. So is this something where, go ahead, just from a scientific point of view, is this something where everyone's going to maybe get it at some point?
Yeah, so I think so. That's a good question, Jen, and let's just unpack that, for a second. So the if somebody who's vaccinated develops symptoms, they should get tested. We know that people who are vaccinated can get a mild illness, usually mild illness, moderate illness. They could be COVID, and they should get tested if they're symptomatic with that illness. At this point, much of our surveillance system done by the CDC is really, geared towards the severe complications, the hospitalizations, deaths due to COVID. But you're right, we may not be picking up all of the cases among the vaccinated people who are vaccinated, because they may think that they're not getting tested. And I think there's a cautionary tale in this, is that we got the warning sign when we had that large outbreak in Cape Cod, in Provincetown, where there were a lot of cases among people who are vaccinated. And more recently, we've had an outbreak in Connecticut College, which was almost entirely among people who are already vaccinated. So there is a risk that people who are vaccinated can get infected. I think the good news is, again, what the evidence is telling us, at least at this point, is that those cases tend to be mild, they tend to be moderate. The vaccine still protects against infection and illness, but not 100%. And the key issue is that they are going to save lives in preventing the severe complications of COVID, whether it's hospitalizations or deaths.
So when in doubt, if you feel like you have symptoms, get tested so that to, quarantine yourself to not spread it to others, right?
Isolate to protect your family, your loved ones, your neighbors.
Dr. Ko, pleasure having you on once again. Thank you, and we'll have you back on in a couple months to break down COVID and see where it is in Connecticut then. Thank you.
Okay, very good. Thank you very much, Jen.
Well, that does it for us on The Real Story. If you want to watch these segments again, head to fox61.com or download the Fox 61 app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61.